And then even this is one patient of SBRT, like where we give a lot of high doses of radiation only to a particular site. This is one particular patient of CA cervix who was treated earlier, but then presented with a small metastasis at the level of vulva. So this patient was not operable, and there were other comorbidities and all. And if we have to treat this patient on a normal machine, it will be very difficult to identify the urethra and all. But we can see how nicely we could target this lesion with the MR-based LINAC adaptive therapy. So then apart from MR-LINAC, I also specialized in MR brachytherapy. Brachytherapy is one very what you call a skilled procedure. If at all, if it is done very properly, we can reduce the doses to almost all, improve the local controls by almost all 10%, and the side effects will be almost all reduced by 50%. I'll show you one clinical example. We have, what we have is the hybrid interstitial brachytherapy machine. What we do here is, suppose this patient is one patient who has already received external RT 45 gray, but we can see that there is a lot of residual disease, and almost all the both the parametrium are completely invaded with the disease. So if you have to treat this patient with conventional brachytherapy, there's no way you'll be missing all the tumor, and patient will invariably land in local recurrences and in fact residual disease. But here we have a applicator where we can target the residual disease with wherever the disease is. Under the ultrasound guidance, we insert the needles into that areas and then target so that we can deliver maximum possible doses to these cases. So this is another case where we had a lot of parametrial disease on the left side, and that was also targeted with an oblique needle. And this is how we could deliver the doses to the highest possible. And this follow-up patient, follow-up scans, the PET scan of this particular patient had no residual disease after 3 months. And it gives an immense satisfaction if we see these follow-up of patients who come to us without any complaint of bleeding rectum, or in fact, Dr. Santosh is here. He usually gets all our referrals for bleeding per rectum and hematuриas and all. So I think these problems will be tackled in future from this technology. Till now I have done around 52 patients of CA cervix patients treated with this MR brachytherapy, which include numbers from my previous institute. And I'm very happy to share you that almost all, except for 3-4 patients, almost all the patients are doing quite well, and except one patient who had some distant metastasis and 2 patients who had some local recurrences. So this is how we could improve our results, and we are happy to share that all our work we have been constantly producing in national and international conferences. And thank you so much for this opportunity, madam. Thank you.